Pat, tell us a little bit about the different ways MS can produce neurologic dysfunction, symptoms and signs.
So certainly the nature of MS is to have, and we're talking about untreated MS right now. The nature of untreated MS is to have recurrent attacks on the brain and the spinal cord that can be visualized. These are now resulting, they're focal inflammatory lesions where you have a breach of the blood-brain barrier, edema, inflammation, and there's variable tissue injury, demyelinization, killing of cells, axon injury, reactive gliosis, and you can visualize this on an MRI scan. So to give you a concept, 80 to 90% of the lesions that form on the brain MRI are silent. The patient doesn't know they've occurred. You can't detect them on the neurological exam, but you're paying a price because ultimately you're going to lose CNS reserve as the brain ages, as it continues to hit, as you have a greater quantity burden of disease, you will pass a threshold where you'll begin to see abnormalities. In addition to these kind of focal inflammatory lesions, we now know that there's microscopic injury, and this is a very important component of the neurodegenerative phase. We know that normal appearing brain tissue is abnormal in MS. It's been estimated that 70% of the normal appearing white matter and gray matter shows microscopic disturbances. One manifestation of this is the fact that total brain atrophy, the brain is shrinking 3 to 10 times higher than matched age controls in MS patients, even when they may appear to be clinically stable. Depending on what tracts are affected, what circuits are disrupted, you can have a whole host of neurological deficits that would be weakness, spasticity, sensory loss, positive sensory phenomenon such as pain, tremor, imbalance, decreased vision, double vision, cognitive issues. And then as you continue, you have a whole host of symptomatology. So these hits can result in bladder disruption, in bowel dysfunction, in gait and walking abnormalities, in tremor issues, in cognitive issues. And we also know that some major symptoms that are increased in MS are fatigue, which we don't fully understand, and depression. Depression is seen in at least 50% of MS patients in a significant way. So there's a whole host of ways that MS can cause issues.